We're now going to transition to this final but first of the day panel, which is going to focus on how data and research can support our equity goals and ways in which data and research sometimes might be perpetuating inequities. Our moderator is Kirk O'Brien from Casey Family Programs. We're very grateful that he's taken on this role. And you can learn more about Kirk and our other panelists in the bio document that we've put in the chat. And again, we do this simply to make sure that we're not spending too much time on introductions of our fantastic speakers and get more time to hear what they have to tell us. So Kirk, I thank you and I hand this over to you.
Thanks, Catherine, and hi, everyone. My name is Kirk O'Brien. I'm a Senior Director in the Research Department at Casey Family Programs. We want to welcome you to Understanding and Addressing Inequities in Data and Research. And I'm going to take just a quick minute to provide some thoughts, and then I'll turn it over to our panelists and discussant. And so what we're really going to be talking about today is how we do things better to work with and support youth and families. We know that data and research play a pivotal role in telling us what's working and where are some areas of improvement. So on our panel today, we'll be talking about the role data and research plays in addressing inequities for populations of youth and family, including people of color, sexual orientation, gender identity, gender expression, and intersections amongst those groups. So from a data and research perspective, are we meeting the needs of youth and families with our current approach? So a couple things to think about. How are we engaging around data and research? And what questions we ask, how we determine what to collect, how to collect it, how to analyze it, how to interpret findings, and how to share those findings. And what's critically important is how are we engaging with those with lived expertise in all of those activities? So just a little moderator challenge. What is our individual role in addressing inequities in data and research? Have that in mind as you're listening to our speakers today. So as a field, how are we doing? Well, I would say we're a little uneven. So what we're going to do today is talk about how we can even things out a little bit and center equity as part of data and research. So our panelists and discussant will be providing insights from their perspectives. These insights will provide ideas for how we can reshape the way we engage around data and research by sharpening our equity lens. We'll hear some concrete actions for addressing inequities so that we're better able to work with and serve youth and families. So quick introduction of our panelists. We've got Jenita Parekh from Child Trends, Amy Hawn Nelson from the University of Pennsylvania, Krista Thomas from Chapin Hall, the University of Chicago, and we're really fortunate to have a researcher with lived expertise as our discussant, Dr. Sharrica Miller from Cal State Fullerton. More information is available for all of our speakers today if you look for the bios. Please drop in any questions in the chat and we will address them as we move along. So I'm going to turn it over to Jenita.
Great, good afternoon. Thank you all so much for the opportunity to present and to be on this panel. We at Child Trends are so deeply committed to advancing racial equity, both within our organization and throughout our research with youth and families. And so this presentation is about how to use data to understand and to advance racial equity. So I like to start with an example of some news headlines I saw right when COVID came out. So for example, one of the headlines was, data show that Black Hispanic people are at increased risk of hospitalization due to COVID-19. Another headline was, multiple analyses of available federal, state, and local data show that people of color are experiencing a disproportionate burden of COVID-19 cases and deaths. So this is pretty typical of how we see research on disparities presented. And this is really important. It's very important to highlight disparities. But this is also where we see research stop sometimes. And then policymakers have to decide what to do with this data. And sometimes when it stops here, it leaves a lot of room for subjective interpretation. So for example, just looking at the headlines, that might suggest that race causes disparities and that race itself is a risk factor for COVID. So to really advance racial equity, we have to do a more fuller, more accurate picture of what's happening. So how can you use data to understand and combat racial inequities? So we see the path to achieving equity as going beyond documenting disparities to really identify underlying causes and contextual data points that contribute to those inequities. So for example, what systems and institutions are at play that are causing these disparities that we're seeing? Equally important, it's incredibly crucial to engage those most impacted by inequity, to learn about both the root causes and underlying causes, and also to learn about what they might see as solutions and to afford an opportunity to co-create solutions. So for, a quick example of this is to conduct listening sessions or focus groups where you might present, for example, disparity data and learn from those who are experiencing these disparities, learn from them what those underlying causes are and what they see as solutions. And then the idea is that you're able to propose informed solutions and policies that are likely more likely to be accurate and effective. So then in my search, I was so thrilled to find a different kind of news headline, which said, "Why racism, not race, is a risk factor for dying of COVID-19." So what this article and this headline does is that it really highlights the root causes and pathways for COVID deaths, and it provides all this contextual information and additional data points. And it does this up front and in the title. So in this next slide, I'm going to show you what this looked like. So there is a lot on this slide, but really kind of what I want you to take away from it is that what it demonstrates is a root cause analysis, which is a process for examining why disparities exist. And what it does is it tells a more full story. So I'll walk you through a little bit of what this author did, and I've adapted this a little bit to highlight the points. But it shows that COVID disparities are the result of certain communities being more exposed to COVID, these communities being less protected from COVID, and these communities having more chronic illnesses. And they're more exposed, less protected, and have more chronic illnesses because of the kinds of jobs they have, because of the kinds of places that they live in, including housing and the neighborhood, because of access to healthcare, because of potentially mistrust of the government due to past historical exclusion and abuse. All of these things can then be linked back to poorly funded schools, educational segregation, residential segregation, which can all be linked back to racism. So we learn just kind of by looking at the exploration of contextual factors that being Black, for example, is not responsible for the disparities we see in COVID deaths. Rather, it's really these kind of systems and conditions that are responsible for the disparities we're seeing around COVID. So when COVID came out, as you all know, the solutions, the initial solutions to address COVID were kind of what you see here: social distancing, mask use, and getting vaccinations. And these are all great solutions, great individual solutions, and there's nothing wrong with them. However, now that we know more about the context, about why disparities exist, are these individual solutions enough? So for example, what is the likelihood that somebody who lives maybe in a 2-bedroom apartment with 6 other people, 4 of whom are frontline workers, is able to really socially distance in that situation if somebody gets sick? And we all remember how hard it was to come by really appropriate personal protective equipment when COVID hit. It was not easy to get really sort of strong protective equipment. And you had to be really savvy to get one. In addition to vaccines, when they first came out, you had to be really internet savvy to get that as well. So what if we looked at system solutions as well? Could we move the needle more on disparities? So for example, what if we looked at providing more protective equipment for frontline workers, hazard pay for those who felt like it was too dangerous, free testing, and priority testing for certain populations that are more exposed, priority vaccinations? What if we really sought to explore and understand the mistrust of vaccines and address that as well? Would we be able to move the needle more in disparities? So in sum, why does context matter? It gives policymakers a full story. It might trigger or prompt different policies, and it helps us move away from any harmful narratives about people who are impacted by inequity. It's important to do this upfront in presenting research findings. I don't think people necessarily these days read through an entire 30-page report. So it's really important to do this upfront in the executive summary in the title. What I presented today is one of 5 guiding principles that we have for integrating racial equity. And although this is all kind of birthed from a racial equity perspective, these principles can also apply to an equity by sexual orientation and gender identity, as well as ability. I'm happy to talk more about that later if folks have questions. And this is a resource for where some of this information comes from. Thank you.
Thanks, Jenita. We had a couple of comments in the chat, but one to just follow up on, see if you had anything else to say. There was a comment about race may not be a risk factor, but isn't racism one? I think you covered that pretty well on slides 9 to 10, but if you had any other comments.
Right, correct, yes. So I think you hit it, yeah.
Okay, we've got it covered.
Yeah.
Okay, and so I think we'll move on to our next speaker. I do just want to give a shout out to Dawn dropped in a couple of Child Trends resources in the chat. I know that I've used the guide a lot, so those are great resources to check out. So thanks, Jenita. Okay, so Amy, we're going to move on to you, centering racial equity throughout the data lifecycle.
Yeah, hi everyone. All right, I think we're. All right, so I'm here to talk to you about a toolkit, and I've just dropped the link into the chat. Hopefully everyone can take a moment, since we're all at screens, to feel free while I'm talking to click through that document, because that's where the good stuff is. In the amount of time that I have today, I will not be able to cover even like a piece of it, or a substantial piece. So a little bit about who I represent and what we do. I am part of a small organization called AISP, Actionable Intelligence for Social Policy. We are mainly applied researchers who support government agencies. So our real work is running a network of sites that regularly integrate data. And we do a lot of stuff related to that, like a lot of guidance. We write a lot of white papers. We do a lot of TA, a lot of advocacy communications, and we support actionable research. And I'll go into what I mean by that. So most relevant here, let's see, okay, is we do a lot of what we call knowledge generation. So we do a lot of, I don't know, way to describe it, maybe cat herding. We get really smart people who are doing great work, and we learn a lot from them and then help write it up in a way that is understandable and palatable. So we do that quite a bit. Here are some examples of that. I encourage you to go to our website. We look around, look for needs of resources that need to exist, and then we seek to create them. That's a lot of our work. All right. I'm sorry, I'm having trouble advancing. It is a user error, not a technology error. All right, so this is the main work. Please go to the link I dropped in the chat and check it out. Most importantly for AISP, we want to make it very clear what we are and what we're not. So our focus is relational. Our opinion and kind of our many years in the space has shown us that data sharing is not a technical issue. It is a relational issue. It's about trust. So of course, that is inextricably linked to the issue of racial equity and equity in general, right? We often have inequitable circumstances because of a lack of trust, a lack of understanding, and of course, structural forces that drive all of that, right? So where this work came out of was an expressed need from our sites. We had a lot of government agencies that we were working with that said, hey, we know our race data is problematic. We know that racism is driving the disparities that we see. We know that our staffing is problematic. This is an incredibly white space. Data integration is an incredibly white space, right? We know all of these things and we don't know what to do about it. And we looked around and we said, you're right. Like there's no great guidance about this. We don't know what to do about it. So we worked really hard to follow kind of our best practices that we described in the toolkit, and we worked to get funding, and then we worked to pay people appropriately to support us in co-creating this toolkit that you see. We had a range of contributors. They were very purposefully selected based on experience at the intersection of data integration and racial equity. This toolkit is racial equity focused, but of course, equity is intersectional, right? And racial equity is linked with all other identities. So we do have some examples in the toolkit that are relevant. For example, we talk about SOGI data collection, our data collection section. So definitely check that part out. We also focus what we called work in action. So this is work that is actively ongoing. None of this is theoretical, hypothetical. These are actual government agencies and sites across the United States who are actively working to center racial equity through their data integration work. So the core, if you remember nothing else, there are 2 points. This is one of them. The main point is that right now we're at this point of opportunity, right? So the 1800s, you can think about that as the infrastructure for railroads, right? 1900s was highways. Our current century, our infrastructure is data related. We have the ability to center equity and to center racial equity in the public good in developing data infrastructure. And we can either make that front and center, or we can go forward as we did in previous generations and centuries and not have a race explicit lens to this and say that, data is neutral, right? Of course, everyone on this call knows that is 100% not the case. There's nothing neutral about any data use, race neutral about our data use. So we must co-create data infrastructure that promotes racial equity in the public good. And we have to do that explicitly. So the big question is, or the centering for this toolkit is across 6 stages of the data lifecycle. We talk about planning, data collection, data access, the use of algorithms and statistical tools, data analysis, and reporting and dissemination. Now, it's important to note that most of the work that we hear about and talk about is on the last parts of the section. Our work focuses a lot on planning, data collection, and data access. That's, if you see anything that we release, that's mainly what it's focused on. But the point of this work is that we have to center racial equity at all stages of the data lifecycle. We can't just focus on analysis or reporting and dissemination, as a lot of these efforts are. A lot of the work is really around staffing. It's around planning. It's around securing adequate funding for work before you begin it. It's about data collection, which is at the very front of most efforts, right? Before most efforts even start. This is just an example of one of the frames that we use in the toolkit, and I encourage you to check it out. And the biggest takeaway here is there's something for all of us, right? There is something that every single person on this call, every person in every organization can do to center racial equity. And here I've just dropped in a few ways to contact me and encourage you to do so. Thank you.
Thanks, Amy. And again, great resource, the toolkit you mentioned. I know that's a resource that a lot of our colleagues use. We're going to keep on moving. So we're going to transition over to Krista Thomas, who's going to talk about understanding and addressing inequities in research opportunities for child welfare leaders and decision makers. Krista?
Great. Quick sound check. Sound okay?
Sounds good.
Perfect. Hi, everybody. I'm Krista Thomas. I'm a senior policy fellow at Chapin Hall, a nonprofit policy research institution associated with the University of Chicago. And I am so pleased today to talk with you about opportunities for child welfare leaders and decision makers, or really any human service leaders and decision makers, to understand and address inequities in research and evaluation. And the work that I'm going to talk about is a partnership among several organizations, including the Capacity Building Center for States, James Bell Associates, the University of South Florida, and Casey Family Programs. And I am delighted to report that Kirk O'Brien and Dr. Miller on our panel today are also partners in this work. We have a collaboration that is focused on research and evaluation capacity building in jurisdictions. And we came together originally in support of the Title IV-E waiver demonstrations and their associated evaluations. Our work together has evolved into the Family First space and supporting the evaluation efforts associated with evidence-based programs under the Family First Prevention Services Act. And currently, we are centering our efforts on a few issues that are related to advancing equity in child welfare research and evaluation. And one of those projects I'm really excited to talk with you about today. Now, we rightfully emphasize the critical role and responsibilities that researchers and evaluators possess in advancing equity in research and evaluation. And there's a lot of renewed energy and commitment in this space, and it's inspiring. And there are some really tremendous resources that are out there, several of which have been featured by my co-presenters today. As a complement to that conversation, what we wanted to lift up was the significant power that leaders and decision makers at the federal, state, and local level have in identifying and addressing inequities in research and evaluation. And I'm talking about inequities impacting not only communities of color, for LGBTQIA+ communities, persons with disabilities, and other groups that have been historically and systematically marginalized and disenfranchised in human services research and programming. It's leaders that often shape what research and evaluation gets conducted and often control the investment of resources in this important work. And we'd like to call attention to this power and influence. And we're working to design and support decision makers and lend some structure into efforts to promote more equitable research and evaluation efforts. To structure our work in this space, our team developed what we are calling an influence framework for leaders and decision makers that highlights specific ways they can promote equity throughout the full research and evaluation lifecycle. It begins with opportunities at the stage when research and evaluation needs are first being conceptualized. And it moves to the formal process for commissioning requests for proposals and selecting successful bidders. Then moves on to the role that leaders can play when research and evaluation activities are being conducted, and then concludes with ways that leaders and decision makers can be thoughtful and intentional about in their efforts to promote equity in the decisions that they make as a result of research and evaluation findings. And I am excited to share elements of our preliminary thinking today and welcome the feedback and ideas from today's great participants and panel members. Like Amy mentioned in her presentation, prioritizing equity is essential from the onset. And strategies that leaders can deploy include calling on diverse voices to inform the development of research and evaluation priorities. And this can look like cultivating representative teams or working groups or establishing advisory committees, but intentionally leveraging diverse voices, including those with lived experience, to help shape early development of research and evaluation priorities. Leaders can also engage the communities, and they should, that stand to be most impacted by research and evaluation efforts in much of their early thinking. Community voices are critical for understanding the research questions that are most important to them, and they can help define the problems that truly need to be solved. Leaders have the capacity to consult with community members on how important constructs should be defined and measured. For example, for years we've talked about concepts like well-being or protective factors, but how have we traditionally defined those constructs? How have we measured them, and what forces and factors have influenced that decision? I think we've got a lot of opportunities to rethink some of those things and define and measure key constructs in ways that are more responsive and equitable. And leaders can call on representative voices to drive that conversation and authentically solicit their feedback on what data collection opportunities and methods might work best and feel best from their perspective. And related to that point, leaders can explore and acknowledge with humility and transparency from the onset how communities have been previously impacted by research and evaluation and honor those experiences in any future endeavors. And together, leaders and decision makers can partner with impacted communities to determine shared priorities and common language from the initial conceptualization of a research and evaluation project. When designing RFPs, leaders can have the capacity to specify their agency or organization's expectations or requirements for how equity issues can be centered in proposals. The RFPs themselves can elevate as preferred approaches, methods that engage and empower community voices, like community-based participatory research. And leaders can ensure that panels reviewing and recommending proposals for funding include diverse representation, including persons with lived experience in whatever areas are being studied. And when developing scoring rubrics and selecting successful bidders, leaders can prioritize proposals that respond to issues impacting disparities and demonstrate capacity to benefit underserved and systematically disenfranchised communities. And then lastly, and perhaps most importantly, leaders can acknowledge and provide sufficient time and resources to meaningfully engage representatives as partners in the process. Building those relationships and trust with communities take time, as do many responsive qualitative methods. And research and evaluators are often need to work in tight budgets and that are at odds with more equitable research and evaluation strategies. And so acknowledging this and resourcing more intentionally from the onset can be really helpful. I think I'm running out of time, so pretty quickly. The role for leaders and decision makers doesn't stop at the time of funding, and there's opportunities to remain engaged and involved throughout the life cycle to ensure that that commitment to addressing disparities continues in alignment with what was originally outlined in the RFPs. Leaders can support research teams to engage community representatives in conversations around meaning making about the data being collected and actively check in with how they're experiencing the research process. And as researchers are sharing their findings, they can require the findings are disaggregated by race and other available and appropriate demographics. And as leaders are making sense of the findings that are being presented, they can intentionally consider how racist laws, policies, or context may be influencing how they're interpreting what they're seeing, all the while being mindful of how their power and internal biases might be influencing how they're responding to what they're learning. I think I'm out of time, so real quick. Also then being really mindful about using their findings thoughtfully in planning and decision making. And you can see some of the main points that are on that slide. Sorry to skip over that. So as we circle back to this framework as a whole, we recognize that it aligned really seamlessly with the Plan, Do, Study, Act cycle that we tend to see in continuous quality improvement efforts. And rather than a linear approach, we see this work as cyclical, with opportunities for leaders and decision makers to continually evolve and improve in their commitments over time. And if we are successful in doing this, our theory of change suggests that we will see research that centers equity issues, that we can see equity related priorities influencing proposals and decisions, as well as the grants and contracts that are funded. We can see resources be more equitably distributed, increased stakeholder representation, sustained emphasis on equity, and then hopefully intentionally leveraging findings related to equity to inform planning, decision making, and resource investments. And we look forward to sharing a guide with you later this summer or later this year. Sorry for going a little over time.
No, it was great, Krista. Thank you so much. We are going to move on now to our discussant. So we'll invite Sharrica Miller to join us. Dr. Miller, it's great to have you here. And we're going to hear from Sharrica, Dr. Miller, about her reflections on what we've heard today.
Thank you, Kirk. And thank you, Krista, Amy, and Jenita for sharing those perspectives on ways we can understand and address equities in data and research. And so I wanted to just share really kind of the three takeaways that I got from their message. And I looked at their message from a couple of different lenses. So obviously the first lens that we're all looking at it is how can we decolonize human services research, and how can we sort of center the voices of those that have been historically excluded and put those, to the forefront. And I also looked at it from the lens of a nurse. I'm a nurse by trade. I'm a pediatric nurse practitioner. And I have to say that our profession is not quite actually as far along as you all are. We are beginning to have talks about privilege and racism in nursing and how that affects health outcomes and how that affects how we conduct nursing research, but we are not quite as far along as you all are. And I think most importantly, I'm looking at it from the lens of someone with personal lived experience. I spent 12 years of my childhood in foster care. I'm out here in Southern California. So I was in Los Angeles County, Orange County, and Riverside County. And I was on the receiving end, right, of all of the policies and the research that emerges from child welfare and human services disciplines. And I'm now a researcher and advocate, right? And so, and my research focuses on the transition readiness and health services utilization among transitional age foster youth, right? So I kind of looked at it with all those different lenses. And I really had 3 takeaway messages that I took notes on. And the first one, and I actually was not here yesterday, but I saw it in the comments and I had it in my notes already, and I think it bears repeating, which is the nothing about us without us. And it's actually a saying that we used to say when I was part of an organization called California Youth Connection, which is an organization comprised of current and former foster youth. And the former foster youth teach the younger foster youth how to advocate for legislative changes. And that was sort of our mantra, our guiding principle. And I think that bears repeating, which is that all of the research that we do and that we conduct, we need to include those voices, right, on a very fundamental level from the very beginning, as our speakers talked about. And so what I did is I joined that organization. This was early 2000s, right when I was starting my PhD at UCLA. And I included those youth in every single step of my research process. Part of my research was qualitative. I asked them questions about transition readiness in order to try to get to, figuring out what were some barriers. And I had them helping me with how to design those questions and what questions to ask. And then I used some questions from California Health Interview Survey. And what I did is went through the questions with the youth to make sure they understood the meaning, right? Like, do you have a primary care provider? And making sure they understand, do they even know what that means, right? And so just a reminder for us all to continue to involve them in that research process. The second point I wanted to make is really extending that conversation, right? And how can we nurture individuals with lived experiences so that they play an even bigger role, right? So that we can transition from them just participating in the research, but also to being able to conduct the research, right? Which is what I now can do. And in that group, that CYC group, California Youth Connection, we taught the youth how to find evidence to support the policies that they were proposing, right? We had to stay at the Capitol. We would take them up there to meet with different legislators. And we focused on one bill every year that we were trying to get passed. And we used evidence to support that bill, right? So that was definitely on a small scale, but because of the mentoring and the nurturing, a lot of those individuals went on to get bachelor's degrees, to work in human services, to become social workers. And just one, I know that's a small number, right? But I know of one that is now finishing up her master's and is now conducting the actual research, right? So I think that needs to start to be part of our discussion. It's how can we nurture these individuals through the pipeline so that they are now at the forefront, I should say, right, are now at the forefront of conducting that research because we are the ones who have lived through it. And then my last point, really, I think Jenita touched on this the most, which is making sure that we change the narrative when we disseminate data, right? To include an awareness of the systemic factors that contribute to the health disparities or the different like disproportionality in the child welfare system, right? I remember doing a talk with Karen Bass, Congresswoman Karen Bass, about disproportionality because I lived it, right? I've been a foster kid in the foster care system and gotten placed with different homes where the cultural background didn't match mine and how that affected me, right? And so changing the narrative when we're disseminating that data to discuss what systemic factors lead to that, right? Is it just that Black families use drugs more and abuse their kids more and neglect their kids more? Or are there systemic factors that we need to include when we are putting that narrative out there and disseminating that actual data, right? And so I think Jenita did a great job with that when she talked about how misleading those COVID-19 headlines were, right? When they first came out about these certain communities that had high mortality rates. And she touched on it very briefly, and I think we can expand on that a little bit, that conversation carries on to vaccine hesitancy, right? And the headlines being, let's say, there's a high rates of vaccine hesitancy among the Black communities, right? Without discussing any of the factors that led to that and the government mistrust and how we actually address that. And so I think as researchers, it's our obligation to make sure that we are doing that, right? And in nursing, we're not quite doing that either. We're doing a really good job of exposing. I'm faculty as well. I teach at Cal State Fullerton. I've been teaching now 10 years. I teach research courses and I teach our doctoral students as well. And we're doing a good job of exposing them to health disparities, right? So that they know which populations they need to address and certain risk factors. But we're not doing a great job of really breaking down what leads to that, right? And what systemic factors lead to that, and how that influences how we research and the frameworks, the conceptual frameworks and theoretical frameworks that we use to guide our research in nursing, right? So very similar to what we all are doing with human services research. So I think it's really important as we move along that we remember that point as well, that it's our job to make sure that the narrative we put out, because I think, I can't remember if it was Jenita or Amy that mentioned, people are not going to read through the whole 30 pages, right? And so making sure that that narrative is clear, very much so up front. So I want to thank you again to Krista, Amy, and Jenita for that amazing presentation. And thank you to you all for the amazing work that you are doing to create a more equitable society. And I just wanted to give that sort of human perspective and reminder that the research you conduct and the policies that you create affect real individuals like me and my family. So I do thank you all for that.
Thanks, Dr. Miller. That was fantastic. And we're going to invite the other panelists to come on camera as we start a little discussion here. And I just wanted to follow up actually on one thing, Dr. Miller, that you just alluded to. So I know we'll get into this a little bit more when we talk about specific strategies, but you mentioned something maybe we could just follow up on real quickly, and that is how do we increase the number of researchers with lived experience? Do you have any suggestions, or does any of the panelists have any suggestions for some ways we can do that?
I would love to hear also, what you all think. I want to jump in first and say, definitely, I think mentoring is a really, really important part of that. As Krista mentioned, I'm part of the group with Kirk and Krista, and we're all working on this project together. And I think the mentorship that I've received, just being around these wonderful individuals has been tremendous. And I'm also part of another group where we have a DDS grant, and we are creating a peer ambassador program for foster youth who have received regional services. And a big part of that is the mentoring, because we use former foster youth, such as myself and other ones, to find the evidence and create the curriculum and things like that. So I think mentorship is a huge, huge part of that. And also, exposing them to how the research can actually, have concrete changes, practical changes, and when they see the outside of that. So with CYC, when we get a bill passed, it is like inspiration for the youth now to work harder to get another bill passed. So I think seeing the impact they can have is also very inspiring as well.
Thanks, Dr. Miller. Go ahead, Amy.
Yeah, we think about this a lot. We think a lot about too, how it's really important to define what experiences you're talking about. Like, I do think having system involvement, like clearly, Dr. Miller, like your experience in the foster care system is invaluable for understanding that system. But we found it's really important because everything we do is cross-sector data. So like we need folks who are data analysts who have experienced housing instability. We need folks who are data analysts who attended public schools. Like that's, a lot of the data that we use, especially as backbone data, is Medicaid data, public school data. And so we think a lot about lived experience and what experiences we're talking about. The other thing I'll say just for staffing wise is it's really important to think about analysts and data folks. So I always say that like there are two camps, right? You can take a data scientist and teach them human service and social science, or you can take a social scientist, human service, like caseworker, social worker, teacher, right? And you can teach them data science. Like you really have two choices. And what we've seen in our sites is that a lot of folks are taking the frontline workers and teaching them data science. So it's similar to what Dr. Miller's talking about internships and training. Like instead of teaching the data scientist social science, we often advocate the opposite.
Thanks, Amy. Okay, let me pose another question. I think that this process for some can be very daunting about how to get started and how do we collect and integrate and use data. So does the panel have any advice about when folks are starting, how do we incorporate an equity lens into data collection and research?
So I think first, it's always really important to kind of examine what the purpose or goal is of your data collection. So what are you interested in really looking at? Are you interested in just measuring disparities, or you're really interested in gathering some data that will go beyond that? Maybe some data that might point you to some solutions. And I think when that goal is sort of clear and the purpose is clear, it makes it easier. However, I understand that sometimes data collection is at a point where the research questions have been established, the goals have been established, and so you're already in the midst of it. And I think when you're at that point, I think really examining your biases about who you're collecting data from, if you're doing it because it's a convenient sample, is it accurately presenting your target population? Who are you not getting data from? What are you missing from not getting that data? And what are you willing to do in terms of investment of funds to go to that extra mile to recruit the sample that you might need. So that might mean, hiring trusted community members, building that capacity.
Yeah, I would just underscore a lot of Jenita's points, right? Like it's too late if we're waiting to the point when research questions have already been established. It's getting people with lived experience, community voices involved at the onset of defining what are the questions we want to ask and answer. I think this whole notion of defining constructs is really fascinating because we have ways of thinking about things and defining and measuring them, whether it's by convenience or by perspective or by dominant perspectives that have driven that for a very long time. And I think it's bringing people that stand to be most impacted by the findings to help understand what is it we're trying to solve, why is it important, what are the best information sources, how might we get that information in a way that doesn't feel intrusive, what's going to feel, what's going to acknowledge historical experiences so that we have a different experience going forward. And having that sustained involvement from the onset, I think is critical and also calls upon us to think about doing things in new ways. And it might be different, it might be harder, it might take longer, it might be more expensive. And I think we need to think about those investments really critically from having diverse research teams. You don't need to be a trained researcher to be an effective member of a research team. And building those relationships with trusted community members can be invaluable. And then resourcing the time it takes to build those relationships. We say we want community involvement, but then you need to be in phase 2, 6 weeks in. Well, people aren't going to trust you 6 weeks in. And just being able to account for both in time and resources it takes to do some of these things we're talking about.
All right, thanks panel. We're going to move on to another question. So when we talk about equity issues, often we focus on race and ethnicity. It's often measured and collected more regularly. Is there any additional or unique things we need to be thinking about and keeping in mind when we're collecting and using data and information to understand sexual orientation, gender identity, ability, intersectional activities? Any suggestions? This has come up throughout our 2 days together. and specifically around data and research. What are the panel's thoughts here?
I'll answer it technically first, because there's what Krista was talking about, like the identification, the concepts and that work. So I'll just say technically, like at the beginning of it, you need to talk to your data custodians and the people who are managing the data to see what can be changed. Because we know that our data collection is super problematic in this space. It's obviously binary, doesn't give a lot of other options, but it's really, we do live with legacy systems. And these data systems are archaic and not designed for really flexible use a lot of times. So I would say before you make a big plan, because oftentimes what we see is like, it should be this way. And then you talk to the data custodian and they're like, we can give you 4 fields, so like think about like optimal and then go, okay, what's practical? And then maybe make a plan. So just make sure you don't forget the data custodians, and I'll let other people address the meat of the topic.
Thanks for the question, Kirk. I do think it can be challenging in some ways, because I think that gender identity and behavior, a lot of that is more fluid as compared to when you're looking at race. And I think and I work a lot in the teen pregnancy prevention space and with sexual behaviors in adolescents. So for example, for us, it would be important to, if we're looking at unintended pregnancy, we care more about behavior rather than how somebody identifies, and those may not always be aligned, someone's behavior or the identification. So that's where I think things can get a little bit tricky.
All right, thanks. Let me ask a follow-up question. This has come up several times in our conversation, so I'm going off board here. But one of the things that we've talked about and emphasized is that this process takes time, and it may take more time than we want it to. Does it have to take more time, or what is does it have to take more time, and what can we do to message the importance of taking that time to do this correctly?
I have thoughts, unless I feel like I've let out.
Go for it.
So one of the things that we find really important to focus on, like out of the get-go, are these ideas of what white supremacy culture looks like. And a huge part of white supremacy culture is like perfectionism and immediacy and responsiveness. And institutions that do research are seeped in this. It's like our jam, right? Like it is so comfortable for me to have a to-do list, and like, a lot of our training is around that. And so it's taken a lot of unlearning. I'll say for me personally as a researcher and someone who's worked in institutions my entire career, I've always been in large institutions. So I think that is step one, is acknowledging this is like in the water and in the air. And we have to like really think about it and be purposeful. The other thing is to really focus on funding. So like we are seeking funding right now for something we've got most in hand, but we have a 5-year plan for it. And we had some funders that were like, that just doesn't work for us. And we're like, well, we'd really like your money, but we can't do it in less than 5 years. We are building trust. We're building community voice. These are the things we want to do. And we literally can't do it in your time frame. So, and we had to we're probably not going to get some of that money that we would love to get. So I think like acknowledging that, building it in, and just being like, this is a boundary and a solid one, and we can't move from it to do the work we need to do.
To Amy plus 1,000. To everything, that she said, right? Like, I think you need the time. Otherwise, we're just perpetuating the same way that we have worked. We are complicit in doing work in the same way. And the results are going to be performative, because trying to do years of oppression and disenfranchisement and marginalization to build trust, to create relationships and meaningfully engage. You can't go from nothing to there on a dime. And I think it's disingenuous to put forward a plan otherwise.
Completely agree with Amy and Krista. And I would actually argue that while it might take more time up front, in the long term, it actually saves a lot of time, because how much research have we seen that's been put out that ultimately isn't helpful, and how much time have we spent doing that? And so ultimately, if you do it right, you're saving time in the long run. And if you're, for example, building capacity of those researchers with lived experience, they're taking that with them, going forward. So it's an investment up front, but I think ultimately actually saves time down the line.
Yeah, and it's an investment up front, but you have to continue to sustain and nurture those community partnerships. And so in the long run, like you're saying, Jenita, it won't take as long if you have those established partnerships and that track record of trust.
Great, thanks everyone. One final question for the panel. So one of the things that has come up throughout our couple of days together and comes up regularly for everyone in this field is that we are trying to do good, and sometimes we're really not with how we're collecting information and using information. So how do we, as folks who are collecting data and doing research, avoid well-intentioned work that perpetuates inequities?
I think part of it, Jenita touched on very well, was definitely with that narrative. And so a very concrete example would be if you are a frontline social worker, and so of course I know the child welfare system best out of all the human services. If you're a frontline social worker and you are hearing the data that Black kids are more likely to be removed, then, and especially if you don't really understand that data, then you are going out in the field with that thought that like maybe there's something inherently wrong with these Black families. And so every point of contact with those families, you have that, sort of reinforced in your mind because the narrative that is being put out. And so I think that just can't really be emphasized enough that it's important